What do you get when you mix a health coach and a wellness coach mixed with a ton of curiosity? You get two people who ask a lot of questions about health and wellness. Today we ask, what is lymphatic massage?
Today we talk to the founders of the Cleveland Lymphatic Therapy, experts in the field. So let's get started as we ask.
Wait, what?
Hi, Leah.
Hi, Kamna, your voice is better.
I'm working on it.
Is it hurting still or just...
Not as much, but I've been drinking a lot of home remedies. I've been eating a lot of cough drops. I bought a bunch of medications. I have 6 days to get better.
Your microphone closer to you.
Oh, is it better? You need more volume?
Now try. That's better.
Better? Okay, good.
Yeah. All right. So the home remedies are working and you're ready. So if you needed to rest your throat, give me like a little sign language and I'll...
I will. Thank
right.
you.
All right, but I'm excited about today. Are you? I'm going to introduce them, but we're talking. So let me back up a minute. I started using what is that thing called, Kamna?
Oh, the roller?
Washa?
A jade roller.
Jade roller.
Okay. And I took before pictures and after pictures and noticed a difference. So then I went down this rabbit hole of like, what is this and why does this work? And then from there I found you guys because I typed in like Cleveland lymphatic thing and I found you guys and I was like, I want to interview them. We have to get them on. So then I think I messaged you and then Kamna and I talked about it and we're like, oh my gosh, yes, let's do it. So we're going to be talking to Nasreen Starner and Ali Sehringer. Sehringer?
Sehringer, but
Sehringer. And they are the co-owners of the Cleveland Lymphatic Therapy, which is a private practice dedicated to comprehensive lymphatic care, which is so much for me to say in one mouthful. So, Kamna, you start. Where do we want to start?
Well, I'd like to start at what is lymphatic massage and lymphatic therapy, and then I want to know about you, both of you. How did you come into this? What's like sort of your background? And I just want to go from there, if that's okay.
Yeah, 'cause you also sound excited to talk about it.
Probably a little.
We always are excited to talk about lymphatics. We love lymphatics. And
Okay.
I think we have to start by saying, wait, what? Right?
I love it already. Okay, so tell me what is a lymphatic system?
Okay. So, yeah, I guess starting with what is the lymphatic system and then going to what is lymphatic massage. So,
Okay.
everybody has a lymphatic system and it has a lot of functions, but most notably, it's critical to our immune system. So, you have lymph nodes, these hubs of lymph nodes kind of look like little lima beans, and then lymph vessels. So anytime the body encounters any kind of a pathogen, whether it's a virus, a bacteria, even cancer, the lymph nodes are going to filter that out, fight off the bad guys, and clear it out of the body. Now, it also helps with, I don't love the word detoxing, but on a day-to-day basis, it's like the body's natural janitor. It's filtering out waste products, old cell fragments, fats, proteins, things the body doesn't need anymore. And then it maintains the fluid homeostasis in the body. So it keeps us from having swelling, unless, of course, there's any kind of a malfunction. And then last but not least, it helps with the absorption and digestion of fat in the body.
I didn't know that at all.
And it's a little known fact.
Oh.
What if they're inflamed and stuff? Does that mean they're not doing that job properly?
Yeah, I mean, it essentially means the entire system's not on firing muscle.
But also sometimes people notice their lymph nodes are swollen, and sometimes that means that the body's doing exactly what it should be doing. That it's working in those lymph nodes to get rid of all the waste products out of the system. Typically, that lymphatic system is going to filter about 6 or 7 liters of fluid throughout the day. So it's a lot that's going on through the system.
And so if your lymph nodes are swollen acutely, like short term, that's usually a good thing. Like Nasreen was saying, it's working on something. They're reactive. They're trying to filter out a bad guy, do their work. But if it's chronic, that's when we run into issues.
Okay.
Wow. Where'd we go?
I have more. All right. What if you don't feel anything? Is that okay?
Yeah.
Like, what if I don't feel any of my lymph nodes? Is that still that's okay?
You shouldn't.
You shouldn't.
You shouldn't right now. Yeah.
Never. Okay.
Well, if you have strep throat, if you just got a vaccine, maybe if you're battling something, yes, you should feel something. When you go to the doctor and they say, oh, your lymph nodes are swollen, or maybe you feel one in the armpit after a flu shot, totally normal. But if there's nothing else going on, you really shouldn't be able to tell.
Okay.
So I have not a very smart question, sorry. But if you If you hydrate, does that help your lymphatic system to drain out? Is that a way that it, like you pee it out, or how does it get out of your body?
So yeah, that lymphatic system is going to filter out all of the waste products from the system. And definitely if you're a little better hydrated, it's going to help everything to kind of filter through your system.
Okay.
Because eventually it's going to filter through your kidneys after it's through the general circulation. So it's really going to help on that end to get everything out before you get it filtered that way.
And that's why maybe TMI, but most people after a lymphatic massage say they have to pee. Everyone's running to the bathroom, and that's because we're
Oh,
speeding up that rate of filtration, moving more fluid, and it's excreted.
And if we do a really good one, they have to poop too.
Really?
Intestinal fat's coming out too.
so
Really?
interesting.
Okay, that's a whole other topic we can talk about. But let me back up. Is there a set number? Like, does every body have like X amount of lymph nodes?
It's more of a range.
Okay.
Yeah.
So we'd say typically most people around 500 to 700 is what we hear, but they are doing more and more and more imaging that they find that nobody has the same amount of lymph nodes. Nobody set up like a science textbook at all. And so where they think people may have, lymph nodes this many in one spot or another. I mean, I've even seen, let's say, cadaver studies where they've seen a difference in one area that typically we might say 30 to 40 lymph nodes with as many as little as 6 and as many as 96 in the same area. So everybody. Well, it does make our job hard, but then I think the thing we always tell our clients is that they just really have to listen to their body. They probably are feeling exactly what they're feeling, whether or not we think that that's what should happen based on maybe a surgery they had or whatnot. They're probably feeling whatever they're feeling, and it's just how their body is set up.
Why would someone come see you?
Good question.
Winning personality.
I think the fun thing, so our background, we both came from more of a medical setting, a hospital-based setting.
Okay.
Now that we've moved into kind of, I would say, more of the wellness space, it's a mixed bag. We see people from anything to just wanting to try lymphatic drainage. Like you mentioned, oh, I tried it on my face and I noticed less swelling. It could be for lymphedema, for breast cancer, post surgery, whether it's a knee replacement, a hip replacement, a cosmetic procedure. What else?
In addition, there's people who do have they're born with lymphatic insufficiency. So they might be born missing lymph nodes, missing lymph vessels, or maybe it's set up in kind of a different pattern where things don't drain as efficiently and they are more at risk for a backup of swelling. But yet there's so many reasons we have people come in to see us. We do get any type of surgery, really. But every system really affects the lymphatic system. So there could be cardiac concerns, kidney concerns, vascular concerns, obesity. There's just so many things that could really affect the way, and oncology, of course, Ali said, that could really be affecting this system. Definitely if there's been a disruption to lymphatic drainage with any of these things, or if lymph nodes were removed with surgery, or possibly maybe something like radiation where there might be damage to the lymphatic system, we definitely could see people and it would really benefit them to get that fluid moving at a better rate.
Another kind of portion of the population I feel like we're seeing a lot of lately are women with hormone imbalances who are holding a lot of fluid, kind of feel out of control of their bodies. And maybe you tell your general practitioner and they're like,
You should be feeling that way.
yeah. But they're, like, I know something is wrong and they feel heavy and full and weighed down and sluggish. And those are kind of some of my favorite cases to crack, but we're seeing a lot of that as well, which is neat, where we wouldn't have been able to see that in a hospital setting.
We both are occupational therapists, so I would say also we see a lot of people with maybe some movement pattern issues or tightness in their muscles, and this all can actually, or scar tissue adherence, and this could actually block some lymphatic drainage too. So we're seeing people kind of across the board for so many different reasons.
Okay.
Yeah, I know where my next field trip is.
I know you have to do and document it all.
Yes.
Yes.
Yes. Okay, wait. So let's back up. You might not keep mentioning, but you mentioned surgery a lot. So I guess my question one of my questions is, why would somebody need to see you after surgery? What happens that they would need that?
It depends on the type of surgery. Like I was referring to the oncology procedures.
Yeah.
A lot of time when you have cancer, the lymphatic system is going to be there to kind of try at first to get rid of some of these cancer cells. If the cancer has gone into the lymphatics, first off, they may have to remove many of these lymph nodes if it's in there. But even if they're unsure, they sample some of the lymph nodes. if there's a disruption in this drainage, sometimes people can end up with a bit of swelling from this, called lymphedema. And so that's something that we see a lot of people for, but also just any type of surgery. If there's post-op swelling, if there's, you know, it depends on so many different types of surgeries, but a lot of times the lymphatics are overwhelmed with fluid, and our treatments will help get everything moving at a much faster rate.
Okay, so let me dumb this down for myself. So let's say I had a knee replacement and none of my lymph nodes were intentionally touched, but they were like bumped and touched and whatever like that. That could cause like a little disruption in the whole system, and that's why we would need to come see you to help get it fluid.
Absolutely.
Or if I had something like a lymph node removed to do testing on, my body's going, why isn't that there anymore? We're trying to figure out how to reroute and get it, so you would help get it kind of moving again.
But it could even be like a laparoscopic surgery. I mean, so you think a knee replacement, okay, that's a big incision, a lot of trauma there. But we see a lot of abdominal laparoscopic surgeries or shoulder, knee scopes, just because it's a tiny incision. Anytime there's trauma to the body, just because a lymph node wasn't removed, you have these lymph vessels running all throughout your body, and they're real superficial. They're like 2 to 3 millimeters below your skin and above your muscle. So even just the tiniest of incisions, the littlest of disruptions can cause swelling, cause a disruption to your lymphatic system.
Wow.
Can I say specifically to the knee replacement though? There is a big bundle of lymph nodes that goes up your leg called the ventromedial bundle, and then behind the knee there are your popliteal lymph nodes. I know we talked about oncology procedures causing lymphedema. Out of all surgeries, the second leading cause is total knee replacements, causing that backup of fluid and swelling. And it's not because any lymph nodes are removed, but because of that disruption in the lymphatic drainage at the time of surgery. And it can become quite chronic as people are recovering, and there's more difficulty getting that fluid out.
Wow.
Before we go further, sorry, go ahead.
No, I was saying, even if you had a surgery and you're not having major swelling concerns, lymphatic drainage still helps speeding up healing by clearing out some of the bad stuff, the waste products, the old red blood cell fragments from the bruising, and bringing better circulation to the area. So it's beneficial whether there's swelling or not.
Sure. Before I was going to ask, before we get too deep into the topic, I'd like to know a little bit about your background, how you came to doing this.
Okay, good. Yeah. We should back up. Yeah. I just jumped right in and I didn't ask any of that.
I do love your enthusiasm. Ellie and I both worked together at a large hospital organization for many years, and we were working with people. We're both occupational therapists. We worked with people with lymphatic impairments and many oncology patients at that point. I do feel both of us felt slightly unsupported with trying to help this population. As therapists, a lot is focused on orthopedics. So it was kind of hard for us because this is a very special patient population who has been going through a lot. And we really, I feel like they had our hearts, right? And so to be able to support them in a different way has always been something that Ellie and I wanted to do. But we were actually volunteering at a pediatric lymphedema camp out in Colorado with children who were born with lymphatic impairments. And I do believe just about every other person on the trip, aside from us, owned their own business.
Did you guys go together?
Yeah.
Okay.
Yeah.
Yeah. And they really empowered us to go for it. They said, you can do this. Why don't you? And that was kind of where we got the idea.
Let's ride back. We're like,
on the bus ride back, Ellie had her pad of paper out and was writing all about what we should do. Yeah, it kind of started from there. So
yeah. The other thing too is I feel like even in medicine, the lymphatic system has always been this nebulous, like, what is this? Nobody knows what it, even like your general practitioner might be like, I don't know, we spent maybe 5 minutes on that in medical school.
Right.
But it's really, I don't want to say, having a moment right now. And that part of that is social media. I feel like there's so much more discussion about and focus on the lymphatic system, not just for people who have major issues, but from a wellness perspective, for a lot of things. So social media, for better or for worse, I feel like has really shed some light on lymphatic therapies. And so we thought, nobody does this in the area.
Mhm.
What are we doing?
Yeah, you hit a market. What is the difference between lymphatic drainage and lymphatic massage?
Oh, good question.
lymphatic drainage massage
Oh,
or
okay.
lymphatic massage, it's
It's the same thing.
Synonymous.
Yeah,
Okay.
it's the same. Yeah, I
Okay.
mean, I do feel that a lot of people will take maybe a quick certification class online and say they're certified as in lymphatic massage. There are different levels of training for this, where when you're asking us about our background, we are both certified lymphedema therapists. And so that is a lot more intensive training where we have to learn not only the lymphatic massage portion, the manual lymphatic drainage is what we like to call it, but we also had to learn compression bandaging. And then we also had to do a whole written test to ensure that we know what we're really looking for. So it's more of a medical background where Allie and I are coming from with that.
And the thing with lymphatic drainage is it's not like your typical massage. And there's a method to the madness. So there are very specific drainage patterns. We're not just, rubbing to have a relaxing experience. We're consciously and strategically routing fluid to specific places where we want it to go. For example, like on a leg, we want everything to go kind of behind the knee and toward the groin. We wouldn't just rub the leg or rub down or bring everything outward. There's a certain way you want to go.
And then to speak to earlier what I was saying, everybody's body's so set up differently that even though that's what we want to do usually, sometimes people are like, why are you doing it that way? And I'm like, because this is what your body's doing. But again, what she's saying, it's never relaxing when I'm there. I talk to people the entire session. But they usually want to know about what their body's doing.
I would be like, we would be there for hours because I would ask you. Okay, so there's not a typical, do you get sick afterwards?
Usually no. Some people, yes. If there is a lot of systemic inflammation, if they are experiencing kind of like an acute lymphatic event and you're circulating that fluid and kind of stirring up some, whether it's a viral load or whatever's going on, some people will feel a little crummy for maybe the first 24 hours. But then after that, they say it's like the fog lifts and they feel so much better. But I would say the majority of people feel better honestly
Instantly.
They stand up on the table and I'm an impatient person, so that like instant gratification is love it.
And we are cautious. So there are some things that if somebody comes in with an active infection, of course, we aren't going to reroute that fluid because we know we're sending this lymphatic fluid throughout the body. If they're in some sort of heart failure, we're also not going to be rerouting this fluid in. So there are certain contraindications for us where we're really not going to be making somebody sicker potentially if they already have something going on that we know that we don't want to be doing lymphatic drainage.
Right. Okay, so Kamna doesn't feel good. So she probably shouldn't come get that done, or should she? Because it'll help get it out faster.
She should see us.
Yeah, she would be a good candidate.
See, and you're leaving, so you should go before you leave.
Yeah, I'll call them and see for free.
All right. We'll make time.
It's interesting.
So-
Okay, go ahead, Kamna.
No, my question is a little bit more specific. If you have, I just want to spend a few minutes talking about this, a person who's dealing with cancer, and that's so rampant now, especially women dealing with breast cancer. Is like 1 in 8, I think, is the number now. Maybe it's a lot more frequent, but how, even if they don't have any lymph nodes removed and they just have the sampling done, how does this massage help them?
So
Specific.
when they do the sampling, they are removing lymph nodes, but it might just be 1 or 2 to check. So they
Right.
still have a disruption. But let's
Okay.
say we do have somebody, and I've had 1 or 2 cases where they don't remove any lymph nodes at all. So I think that's what you're getting at. But oftentimes with the surgeries, with the breast cancer patients, they're also doing radiation, chemotherapy. Sometimes they're hormone blocking medications, depending on if it was an estrogen or progesterone driven tumor. And our lymphatic drainage is going to help if there's an impairment, first off, to the lymphatics from either the chemotherapy or radiation therapy causing trouble to the system. Or if we have a hormone where we're maybe overwhelmed with fluid, like Allie was talking about a little bit earlier with those changes, we're going to speed up the rate of return. So we notice with a lot of the cancer interventions, it can cause a disruption to the lymphatic system. And what we'll notice is a backup in this fluid. So things aren't moving as quickly as we would like them to, What our treatment does is that actually speeds up the rate of return of the lymphatic fluid. In addition to if there is a block, an area where it's stagnant, we'll get that fluid moving. And if there's scar tissue, things like that from maybe a breast surgery, we're going to ensure that that's not going to potentially cause these patients to have some sort of restriction there in lymphatic drainage.
And kind of to piggyback off Nasreen's last point about after the surgery, if there is scar tissue, a lot of women, whether they get reconstruction or a mastectomy, whatever kind of procedure they have a lot of tightness in their pec muscle, which is that muscle across the chest, two of them, and in kind of the whole shoulder complex. So when those muscles are really tight and restricted, and maybe people are kind of pain posturing or guarding that area, even that by itself, those myofascial restrictions, we call them, can impair lymphatic flow. So it can help restore mobility, get fluid moving. It's just really good for pretty much all aspects of treatment.
So if somebody came to you after a treatment, would they need to see you repeatedly, or is it like a couple of appointments and they're done, or is it individually based?
It really depends on what level of interventions they've had. I've definitely seen people 1 or 2 times, and I have some people that I'm still seeing 6 years later.
Okay.
Okay.
So it just depends on, and I might not see them every day. I do think the one thing that we really focus on is seeing people throughout their the course of care for their cancer intervention. So we'll see them after surgery, after radiation, after reconstruction, after chemotherapy, because each different intervention is going to affect your lymphatics, but also your posture, your body mechanics, sometimes your movement, your range of motion, your strength, and we're going to work on all of that.
Okay. Well,
Okay.
thank you
so-
for indulging my questions.
Okay, no.
Yeah.
So here's my next question. So let's say I have a sore muscle or something. Like I'm just like, could that be lymphatic backup?
Likely no, but
Okay.
if you have that sore tight muscle, let's say it's in your neck, like we see this all the time.
Mhm.
All of our heads are forward in our phones,
Right.
these tight necks from sitting at the desk. That could then impair your lymphatic drainage. So lymphatics aren't the cause of your tight muscle, but if you're really tight here and you're using your roller, it's not going to want to drain down here as it should. It's going to hit the spider webby tightness myofascia instead of a nice fluid flow, if that makes
Okay.
sense.
So
tight
it's like
muscles,
the
Yeah.
muscle comes first. The pain from the muscle
Mhm.
comes first, and then it might block your lymphatic drainage.
yes,
Mhm.
potentially.
Okay,
Mhm.
that makes sense to me because I was like, oh, maybe my aches and pains are there. Okay, this is a selfish question. I fell and sliced my face open. Do I need to come and get lymphatic drainage for any reason?
Are you swollen?
Having any swelling?
No.
She healed beautifully.
Okay, I healed beautifully. But when you said you'd be surprised when you have trauma to your body, what could happen. So it's mainly when we're swelling from something. Is
Well,
what
I would say for yourself, though, just to indulge your question,
Yeah.
scars are going to continue to heal for about a year before
Yeah.
that they reach that. So you might want to do a little bit of scar massage, keep everything laying down nice and flat, because if things kind of get raised, if they get bumpy, that could cause restriction eventually.
Okay.
But so long as you're not having swelling now, everything
Yeah.
copacetic, you're fine.
Okay.
Yeah.
All right. Now I'm like, oh my God, do I need to go get
My
something
eyes
done?
start swelling.
It's on my face.
See us, but not for that.
You're right. I wanted an excuse, and you darn it, no. Okay.
How does a congested lymphatic system compromise immunity?
Good question.
Yeah. I quit.
How does it? How would? She's having a.
Oh, how would it come just a
Yeah. How would it
lymphatic
affect
system?
immunity?
Yes.
So if your lymphatic system, let's say we're driving in the 35-mile-an-hour road, but things are moving like a school zone, 20 miles an hour. We're going to get a lot of backups and things just aren't moving as efficiently and effectively as they are. So if you already are someone with kind of a stagnant, slower lymphatic system, whether that's because you have some sort of impairment or you're just have a lot of chronic inflammation in the body, then your immunity is going to be lowered. You're operating on 2 cylinders when you want to be on 6. And so your lymphatic system is already going to be inundated with all of the waste products that highly elevated cortisol or inflammation causes in the body. And now it's trying to do its job fighting other viruses, bacteria, and it's just you're using your reserves. You're not operating at full force.
Okay.
That makes sense. And you were talking briefly before, but are there people who should just definitely not do lymphatic massage?
It wouldn't be a absolute contraindication, but we say they're relative. So definitely, let's say I have somebody who has congestive heart failure and their legs are super swollen, still manage to keep things moving throughout their body, but we have to be careful with what we're doing so we don't inundate their internal organs with too much fluid all at once, because we don't want to put anyone, into a really bad situation. With an infection, though, I typically like them to have, depending on the doctor, 48 to 72 hours of antibiotics before I would work on them. It depends on the doctor, though. So some say longer, but obviously, if the patient is tender to touch in those areas, it's really red, inflamed, I'm not going to work on it then at that point either.
And by infection, Nasreen means not like a cold virus.
I'm sorry.
Sort of like a skin infection. There's something called cellulitis that can spread and become a little bit more damaging, but like a skin infection or a wound that gets infected. Not like
Yeah, so if you have a viral infection or you have a cold or something like that that's bacterial, we want to help drain your lymph. Yeah, we definitely want to help to get that. But if it's more of something that could rapidly spread throughout the body and make you septic, we don't want to cause that problem. As far as I know, there's always the concern people have that, like doing lymphatic drainage when somebody has an active cancer. That's a question people ask us quite often. And, originally that was something when I originally went to school was taught as like an absolute contraindication. However, to me, I say no, because I think our lymph moves every single time you breathe. So I don't find that it's, going to be awful if we do some lymphatic drainage. Typically, it provides a lot of comfort for people too. Of course, we always go based on patients and their symptoms and whatever our clients are saying that, is feeling good to them. And we explain everything to them as well.
So very few hard no's. And it's typically people who are a little bit more medically complex or compromised.
Right.
Yeah. But generally, I mean, we see women postpartum, we see women who are 9 months pregnant. So we see almost everything. Very rarely have I had to say no.
I've never
Okay.
said no.
Yeah.
I've never said no, but there's been certain parts of the body I've maybe avoided for a day.
Okay.
You know.
That makes sense.
Can a person do some type of massage to themselves? Like just Leo was talking about the jade roller.
Yeah,
Mhm.
absolutely. And then I feel like now it's kind of trendy. People talk about like the big six, and you have these hubs of lymph nodes. So in your underarms, in your head and neck, kind of at your clavicles, your collarbones, and in the groin and in your abdomen. So there are a few big places that are easy for you to get to on yourself. And you can absolutely do lymphatic drainage on yourself. Some areas are a little harder to get to and we don't have the right angles, and ain't nobody got time for that. So people prefer to come in. But yeah.
Wow.
It's very
So
accessible.
what is your opinion of the jade roller?
Yeah. Good question.
There's all sorts of tools nowadays. People do jade rollers, they use gua sha, they use dry brushes, they use all sorts of stuff. And I personally like my hands. I personally like my hands better than anything, because we're looking for lymphatic drainage, we're looking for skin stretch, tissue mobility. It's harder to gauge with the tools. But to be honest with you, anytime anybody wants to touch themselves and get things moving, I'm all here for it.
Okay.
Yeah, I know. We're kind of split on this. I am less into the tools. Traditionally, in school, the mechanism of action for lymphatic drainage, and I'll spare you, but is a skin stretch because of the anatomy of the vessel. So if you're using something like a stone or gua sha, you're just kind of brushing over the surface of the skin rather than getting that nice stretch. So can you be somewhat effective? Yes, but you can be just as effective for free with your own hands, skin to skin contact. And plus, I think you can contour the different areas of your body better with your hands. For example, the jaw area than you can trying to use a firm stone. But it's personal preference. And like Nasreen said, whatever gets anybody to start trying to move their lymph, then
I really only use my hands here for the most part, unless I'm.
Oh yeah, you guys don't use tools at all?
Tissue restriction, unless there's a lot of tissue restriction. I much prefer my hands to anything. But again, I'm never going to discourage people from trying. So,
But you're trained, so you know what it feels like and what to do. And
we have time and a place for them. But I think some of them have also really been been upsold. So
Oh.
I think if you're trying to be economical, you don't need to buy an expensive gua sha. You can use your hands or, yeah.
Yep.
There are
Looking at
power tools on Amazon, actually just as good as anything else.
I do love cupping though to help with the lymphatics.
Can you talk about that a little bit?
So our hands on skin is what we call positive pressure. You're pushing down and we're getting lymph to drain. So for lymphatic drainage, I absolutely love our hands. But if there's a lot of tissue restriction, things aren't going to move as well. So what cupping does is it lifts that skin up and it creates space in there. So there's better oxygenation of tissue because there is more ability for the blood supply to drain at that point because we've now lifted up. And then it also lifts up off the lymphatic vessels. So there's better perfusion of the lymphatic fluid to move through that system too. If there's tissue restriction, oftentimes things aren't going to drain properly. So I like to use both together.
So when you say tissue restriction, does that mean like tightness?
It could be scar tissue. So we have
Okay.
something a little bit more that a lot of our people with impairments have that's called fibrosis, where this tissue is really hardened and tight and not moving well. And again, what Allie was saying is that we're looking for skin stretch and movement. And if we don't have that movement, we have to get that skin loosened up and moving a little bit better before things are going to drain better.
But to answer your question, I mean, tissue restriction, yes, can be tight muscles.
It could be,
Okay.
Super tight upper traps or whatever we're dealing with.
In regards to the cupping, though, I like it for that hardened tissue a lot to get things moving and draining a little bit better. And then I feel like my lymphatic drainage is much more efficient.
And the cupping we use might not be what most people are familiar with. Like if you see Michael Phelps or the Olympians get cupping and they heat it up with the flame and then stick it on. It's actually a machine. It's more almost like a vacuum approach. So it's like suction cupping with these hard cups to create that negative pressure that Nasreen was talking about. So
Does it hurt?
top layer of skin? No.
And then I also like to use dynamic cupping sometimes on a scar where I'll use silicone cups and I'll go against like the area of restriction and I'll just lift it up. I don't leave big marks. I'm not trying to lift up the whole layer. It's very different, but it's just to work on those tissue restrictions. I keep saying that over and over again. But it's not the same as where they're just lifting up the whole area of tissue. We're kind of working more site specific typically.
Okay. That's so interesting.
Are there other techniques that you use, cupping and massage? Are there some things that we
didn't know
haven't?
about?
Yeah.
Yeah, one of my favorite tools is called vasopneumatic compression, which is just kind of a fancy way for saying leg pumps, or we use them on the arm as well. So they're compression boots. You might have seen them. People are familiar with them in the recovery space, those Normatec boots that you'll see like pro athletes wear. But ours are a little different. It uses what's called sequential compression. So it's going to kind of squeeze the limb. Let's say it's the legs. It'll start at your foot, then go to your ankle, then your calf, then your knee, then your thigh. Drive that fluid upward and help speed up the rate of lymphatic filtration. I mean, it's like the results are pretty instant. You throw them on for a half hour and
they feel very relaxing, most people say too. Very comfortable.
Okay, so let me go back to because I wrote this down. What exactly is lymphedema?
Yeah. So different than we're talking about, lymphatic drainage and all these things. Lymphedema is actually a chronic condition where there's this protein-rich fluid called lymph where the body is not able to appropriately filter that out and you get chronic swelling. It's not like after a surgery when you have swelling. This is here to stay and you can either be born with it, like a structural impairment in your lymphatic system, or it's what we call acquired or secondary to something. So secondary to a surgery, secondary to excessive weight gain, secondary to all kinds of things.
And actually, the number one cause of that is something called lymphatic filariasis. And it's actually horrible and not in the US, which is great for us, but it's from a small insect and it actually is in more like the South Pacific area. It will lay its larvae inside your lymphatics and kind of eat up all that protein and damages your lymphatics that way. So it is a huge epidemic in other parts of the world, though. Lymphedema is an enormous epidemic.
Oh, wow. Okay.
But yeah, we don't see a ton of that here. So lymphedema is when that swelling becomes chronic, and there are different stages of it.
Taking it back.
You're just like us. We go all over. We like take roller coaster rides on these things.
I don't talk about insects. No, but what you worry about with lymphedema progressing is what Nasreen was talking about, that fibrosis. So the longer that this fluid is allowed to be stagnant in the body, it's going to cause inflammation. And that causes our tissue, our skin, our muscles to become hard and what we call fibrotic. So you definitely want to get out ahead of it. And lymphedema, unfortunately, right now is something that can be managed but not cured.
Oh,
Yeah.
really? I see. I didn't know that. Come to you look like you were like, yes, you knew that.
Well, I only know that because I've had some family members go through cancer treatment, and they were talking about lymphedema happening and how to prevent that. And some of it was the physical therapy and the massage that was involved. So I find it very interesting.
I feel like a lot of people have heard the term lymphedema because Wendy Williams actually has lymphedema, and that's kind of brought it a little bit more to the main.
Can you get that anywhere in your body?
Yeah,
You
you
can.
can have it in your face, in your neck, in your abdomen, arms, legs, literally
And
anywhere.
it's, to dumb it down a little bit, it's just like a swelling of
Mhm.
this lymph fluid, and it's not going away. It's not like going out of your body faster.
So
Yeah.
typically before people even start to notice any visible swelling, they may have concerns of feeling heaviness, tightness, fullness. And they're doing a lot more studies now where they're actually looking into, for our cancer patients who we know are at risk, they're doing, it's called bioimpedance spectroscopy, where they're measuring the intracellular and extracellular fluid levels in their bodies. And that way they can actually know before they ever have any visible swelling if they're at risk for this lymphedema based on if they have an increase in inflammation after surgery. So it's pretty cool, all the advances that they're making. But again, I typically tell people if you feel it, you probably have it, whether or not those numbers are showing it. And at that point, we are going to have them come in and we're going to do lymphatic drainage on them. Some people I teach to do it themselves, depending how severe, how many lymph nodes they might have had removed. I want them to be a little bit more empowered to do some of this. And we do get people compression garments too. You know, we're going to make sure that their doctor's helping them kind of get into some compression garments and things like that, because that's going to really help prevent them from having this severe swelling.
So where are you guys located?
Yeah.
We are in Westlake, Ohio, over on the west
Okay.
side of Cleveland.
Are you by Cracker Park-ish?
Not far, yeah. We're by, for anyone on the side of town, Gales Garden Center up on Center Ridge Road, kind of in between Clegg and Columbia. So probably 10 minutes from Cracker Park.
Okay. Okay.
And are you on social media at all?
Yes,
We are Cleveland Lymphatic Therapy.
Cleveland
Okay, great.
Lymphatic Therapy. And Kamala, will you put their information in our show notes so people can get it?
Absolutely.
Okay. Did we
Thank
get
you
any
so
questions?
Do
I-
we have
I-
questions? Oh,
Did we forget to ask you anything important?
I feel like we covered a lot.
we covered a lot.
I don't think so.
I would say that I have not seen anyone who's come here who are wondering like, hey, should I just try this out? I would say 100% of people find a reason that they found it beneficial.
Mhm.
Okay.
Yeah, whether it's that they had something going on a long time ago, or even they just feel a little less puffy, they feel a little more relaxed, they feel that they're just, you know, a little less swollen at the end of a session, a little lighter, a little looser. I feel like everyone feels better after a massage.
Really is really
Wow.
nice. I've done
About
that.
how long is a session?
We have 30-minute sessions, which are just for the face and the neck. We have a 60-minute session, 90 minutes, and then we do have a 2-hour session. But those are usually when there's a little more going on. But
Okay.
hey, if you really want to treat yourself.
Yeah.
Why not?
There you go. Oh my gosh. All right. Well, thank you we can't.
Thank you guys.
You guys so much.
Thank you.
Take care.